Thanks, Senator Warner, and thanks for coming. Sorry I got here a few minutes after your testimony, but I've reviewed it and understand the challenges each of you have faced. My experience, having been around the House and the Senate for a long time, is that many members are motivated and inspired by their own personal experience. This is one for me. I was a student at Georgetown Law School when I got married. God sent us a baby right away. And she was a beautiful little girl with a serious medical condition. And I had no health insurance, law student. And my wife wasn't working, and I was trying to figure out what's next. What was next was to go to the old children's hospital here in Washington and to sit in what they called the charity ward for people who couldn't afford to pay and didn't have any insurance, and to wait to see if a doctor ultimately would walk through the door and say my daughter's name. And I would get to meet that doctor and try to pray to God that he or she was competent to save my little girl's life. And I never felt any less adequate than that moment as a husband and a father, not having health insurance. I remember Children's Hospital said, well, we think you have two options. One of the options is you can go on welfare. And I said, it doesn't sound right for a law student to go on welfare. What's the other option? Declare bankruptcy. I said, I haven't even taken that course in law school, so I'm not sure I want to do that. What happened was I paid them back over a period of 10 years. But I'll never forget that moment. And that has inspired me to be part of this conversation from a personal perspective for a long, long time. The second thing I'll mention to you, and it again relates to personal experience, and the issue of mental health. The debate on the Senate floor for a long, long time was led by two senators, Paul Wellstone of Minnesota, whose brother had a mental illness, and Pete Domenici, Republican conservative of New Mexico, who had a child with a mental condition. And they were trying to get something into the law which was considered revolutionary, that health insurance policies would basically cover mental illness and addiction. That was considered to be radical thinking, socialism or something, whatever the heck they wanted to call it. But it made so much sense that we included it, and thank God we did. As we face the opioid crisis, there were many lives saved by the fact that there's paid-for counseling available through the health insurance policies of after ACA, and you've lived that experience personally. Let me ask you if you have the same vision of this that I do. There was a time that if you said in the world of addiction that somebody had died, overdosed, your best guess was, well, I'm guessing it was a male, African-American male, between the ages of 25 and 35, poor person living on the streets, right? You used to be right most of the time.
That was the stereotype.
That was the stereotype. And then came opioids. And they said, no, the overdose occurred from a white cheerleader in a suburban high school who was taking opioids. I mean, the whole conversation changed. It was no longer just say no. It was an addiction. It was a disease. It was something to be treated. And that changed because of this conversation. Tell me a little bit about you have already spoken about your experience with your family with this.
So I thank you for the question. My father lived with an alcohol use disorder, and so it is something that is an issue in my family for generations. In New Hampshire, I have lost count of how many people I know who have buried loved ones after an overdose death in recent years. And we have worked really hard as a state in order to help people have access to the treatment that they need. But frankly, without the ACA, including Medicaid expansion and the subsidies for the marketplace plans, we would not have turned the tide as we seemingly have at this point. Lives are literally being saved. We cannot afford. We can't afford financially to have these tax credits expire. We will lose providers. They will have to close up shop. We won't have access to that care. People will not be able to afford their coverage. And frankly, the costs will be unbearable in terms of what it will do to families like mine and communities. The heartbreak will kill many people after they lose their loved ones. So I cannot emphasize more how critical it is for these, for us to move forward. The reality is we have more work to do in order to improve our healthcare system. And allowing us to backslide by letting these enhanced premium tax credits expire, we don't have time for that.
No. This morning, this afternoon, there was a statement made on the floor by the leadership, the Republican leadership and Democratic leadership. And speaking for the Republican leadership was their whip, who is a medical doctor, an orthopedic surgeon from Wyoming. And he was talking about all of the shortcomings and flaws he finds in the Affordable Care Act. And he went through a long list, and I read the same thing in a Wall Street Journal editorial on Monday, where they went through a list too. And he was rationalizing voting no on the extension of these tax credits. My challenge to him, as I spoke afterwards, was let's get together and work on all of the elements you mentioned. If they have any merit, let's work on it on a bipartisan basis and fix it. But in the meantime, the waitress at Lou Mitchell's restaurant in Chicago, who just is going to see her premiums double on January 1st, I want her to keep her health insurance while we're doing what we're supposed to do, debating and legislating and improving these programs. And that's what that would really trouble me in terms of moving forward with all these people losing their coverage. In mental illness, I can't imagine what the next week, next month will be like for them.
May I?
Sure.
I think we all saw the toll that the COVID pandemic took on the mental health, particularly of our young people. And the reality is our young people are watching. They have recognized how important mental health is. And indeed, they are going to remember this moment in time. And whether all of us, the adults in the room, right, tried to protect their mental health care, recognizing that, we have started to recover from that impact, but we still have a long way to go.
The last point I want to make, Mr. Chairman, is this. There was a time when mental illness was viewed as a curse and was viewed as something you just didn't talk about. My mother was treated during most of her life. This was a deep, dark family secret because you just didn't let anybody know, not even relatives, if you could avoid it. And then there was this big change, and I really point to the Iraqi war. Those veterans came back with PTSD and said, help me. I don't want to have to face this the rest of my life. Help me. And the conversation went from just say no to dealing with mental illness and addiction as diseases that could be treated and treated successfully. How can we go backwards now? How can we say to these people who need the treatment, no, we're just not going to care for you? I mean, that to me would be a terrible commentary on where we are as a nation. I hope we're better than that. If we don't get the votes tomorrow, the fight continues with more intensity. Thank you, Mr. Chairman.
Thank you.